today we talk about inferior turbinate and inferior turbinate surgeries. معانا استاذ الفاضل استاذ لنا واخويا الكبير استاذ دكتور بليغ حمدي. فده حابب حضرتك اهلا بحضرتك. بس حضرتك what are the indications of turbinate surgery؟
هو الحقيقه احنا الاول طبعا احنا موجودين في راينو ايجيبت 32 وعلى جانب المؤتمر دوت بتشرف بوجودي معاك استاذ دكتور عادل عنتبلي اخويا الصغير وحبيبي. والحقيقه احنا بنتكلم على الانديكيشنز اوف turbinate surgery. او المين indication obstruction of the nose. The main symptom of the patient should be obstruction, and the turbinate should be treated first, and then we can say it's obstructed. I mean, if I'm diagnosing turbinate hypertrophy, it should obstruct the nose, and for a long time with no response to medical therapy. So we have the main indication is turbinate hypertrophy of the turbinate.
Can we do surgery for other indications other than hypertrophy?
Yes, of course. It may be a step for other operations. I mean, for middle turbinate, for example, I can make a turbinate surgery to access the skull base. And sometimes, if the turbinate hypertrophy is a part of snoring, for example, is a cause of snoring, that's the other indications for turbinate.
Professor, you mentioned medical treatment. In case of allergic rhinitis, what you will give as medical treatment?
Actually, the main treatment is the intranasal steroids. Should be used for at least 3 months, and if there is improvement, you have to continue treatment for the intranasal steroids. But if no improvement, then you can refer to surgery. طيب أنا عايز أسأل حضرتك دكتور عادل بيه how to diagnose the turbinate hypertrophy?
At first, we have to go through detailed history. I'll ask patient all the symptoms of the nose to be sure if he's complaining of inferior turbinate hypertrophy symptoms or chronic sinusitis symptoms or nasal obstruction due to septal deviation. I'll go for detailed history, then detailed examination, including endoscopic examination. Endoscopic examination is crucial in all cases before nasal operation. Then I will aid my diagnosis with radiological investigation, and our gold standard is a CT scan of the nose and paranasal sinuses. So I'm going through detailed history, detailed endoscopic examination, and radiological investigations.
Can you tell me, please, Professor Adil, that can I depend upon only the CT scan? If a patient is coming to me with a CT scan, can I depend only on the CT scan?
Never. I'm not treating CT scan, I'm treating a human being. We have cases that are symptomatizing of inferior turbinate hypertrophy and nasal obstruction, while the CT scan shows minimal hypertrophy. Some patients, during the day he is breathing normally through his nose, while during at night at bed is complaining of bilateral complete nasal obstruction. The CT scan is not showing much hypertrophy. If I depend on CT scan alone, I will miss patients, and I may overdo other patients depending on CT scan alone. As I said before, we are not treating CT scan, I'm treating the patient. So again, detailed history, detailed examination with the aid of the radiological investigation and CT scan, I will go for my final diagnosis. Professor Bali, let me ask you, what are the types of turbinate surgery?
Okay. Actually, we have many classifications for turbinate surgery, either extramucosal or submucosal. And we have also a surgical and non-surgical. The surgical, like the partial inferior turbinectomy and the total inferior turbinectomy, which is mentioned to be concomitant, should be done. Partial or middle or total turbinectomy, or other modalities like the turbinoplasties, either to do with a resection, turbinoplasty with a resection, or with a copulation, or electrocautery, or sometimes with the quantum. This is all procedures to do the submucosal turbinoplasties, either surgical or aided with the like a microdebrider, like a copulation, like the electrocautery or the quantum. For the extramucosal, we can do, like I said, partial inferior turbinectomy, or with a microdebrider extramucosal inferior turbinectomy.
For our viewers, can you give a brief about the differences between the surgical techniques? What's the advantage and disadvantage?
Actually, the turbinoplasty is the gold standard for the turbinate surgery. We all prefer the submucosal to keep the mucosa and keep the function of the turbinate, avoid the complications like crusting and like the bleeding, like the adhesions with the septum. This is the main advantage of the submucosal resection. We can do the, as I said, the completion submucosal also. This is with less complications also, but we have to say that most of the submucosal procedures, like the completion, the quantum, the electrocautery, it have some period and then it will recur again. So we have to consider this in mind.
But when do you think, in your opinion, Professor Paley, you will go for extramucosal?
Extramucosal turbinoplasty, actually, I can do it for the in most cases with the most posterior end, bulbous end of the turbinate, of the inferior turbinate. It should be dealt with an extramucosal and not submucosal. And actually, in the middle part and the anterior part hypertrophy, it's better to deal with the submucosal turbinoplasty. Then let me ask you, what about the complications of the turbinate surgery?
We have immediate complications and we have late complications. If I'm talking about extramucosal turbinoplasty, we have immediate complications like hemorrhage. The incidence of hemorrhage is more with the extramucosal. You have to handle this hemorrhage and control the bleeding. If I'm talking about late complications, I'm talking about prostrations. As you said before, intramucosal or submucosal techniques have less incidence of prostrations. Prostration will be more in the extramucosal type. And also, if the patient is going for turbinoplasty, extramucosal type with other septal surgery, and the technique is not very proper, it may lead to synechia and will lead to nasal obstruction later on. And I will not talk about the condemned total turbinectomy. Atrophic rhinitis, we have seen a lot of cases. Immediate post-operative is very good. He thanked his doctor for the excellent airflow, but later on he will start to develop atrophic rhinitis and he will live his life in difficult situation using nasal irrigation for life with not very good prognosis.
Actually, it's a devastating complications, you know, especially the empty nose syndrome. This is a very devastating complication. Actually, I have really read some reports about the patient that's committed suicide after for the empty nose syndrome. That's why we have to be cautious a little bit. It's not a very simple procedure. It's just a simple procedure to work, to do, but not a simple procedure for the complication. And so we have to do a little bit cautious to be more conservative for the treatment of this. Thank you very much, Professor Adel. I appreciate your presence and I'm very happy to be here with you.
I'm very happy to be with you, Professor.
Thank you.
Thank you
very
so
much.
much.